is basically hopefully going to provide some sense of what the exams are currently about. And let's just go right through. Of course, no questions. Another brief comment on the way this course is designed. The courses are designed differently. Some are pure drilling question board prep type courses. This is not one of them. We've put questions throughout. We put questions, MOC breakout session has questions, and the neurology drill has questions. But a lot of this course I also wanted to be content from people who actually are specialists in their field. And so that was the design of this course, to serve as a little bit of a standalone review as well for those who just want to refresh and update on in psychiatry and child psychiatry, and geriatrics. So anyway, let's proceed. So we're going to go through learning what to study for part 1, how to study, the MOC as well. I am de-emphasizing the oral boards in terms of this talk, so you'll see me skip through slides. I'll go on to the ones that are most important. It depends on the time that I have left. But the oral boards are being phased out, and we'll talk about that for a minute too. And then, again, the goal is to hopefully relax. I put here the oral boards because the oral boards, I mean, let's face it, that's like a whole other level of anxiety. But hopefully this will help you relax about the other parts too. Okay, so this is the way part 1 is broken up. You can, so of course all examinations are now through the testing center, computerized testing, Pearson VUE. This is the way it's set up. And you could see, for example, the scheduled break is up to you, how long you want to take it. Different for those of you who last took an exam, when we were all corralled into an arena and duked it out. I always felt like that's what we were doing when they herded us in there. That's all gone. Thing of the past. It's very kind of neat, clean. You go in, you sit down, and you do your computerized test. So psychiatry and neurology questions are interspersed, so there's no separate sections, as those who have taken the part 1 recall. 420 questions total, and this is how they're broken down: 60% psychiatry, 40% neurology. So the part 1 is very interesting. It's gone through changes in the last year that are pretty significant, last year to 2. So what happened, basically, the background to this is that the oral boards have ended for new test takers in the last 2 years. So they'll just sit down, those test takers will just sit down to part 1. And so what they did was they tried to insert more video clips and put certain types of questions that they typically asked in the oral examination and folded it into the second part, the second session to the part 1 examination. And that's what we're talking about here. So the PM session is, you have to monitor your time more carefully. So be sure that you have completed the 100 questions at the 90-minute mark, because there are video clips and you cannot pause or watch segments, pieces of the video. So, it's frustrating. You know how you're used to, those of us who are used to looking at YouTube videos or whatnot, you take the thing, you move it down, and you watch a bit, but no, you can't do that. So for those of you who are used to that, you'll be even more frustrated. So you have to see the whole clip, watch carefully, and then you're going to have to make a decision based on your time whether you want to really replay that clip. And if you're doing well on time, that decision's obviously easier. If you're falling behind, just watch what you're doing with your time. Okay, and sometimes the answer will just not be that clear, and you'll just have to put it down and move on. And the truth is, one way to think about it is, of course, it's probably not clear to a lot of your colleagues either, based on video quality or whatever, And also, some of the stuff that they're putting in, I'm sure, obviously I'm not allowed to work directly with the board if I'm doing a course. Some of the questions that they're doing, I'm sure are being tested. They're experimental type clips and questions. So if that helps you at all, probably there's a couple of those in there too, right? And especially if they get back results that are very discrepant, that one gets tossed, or reworked. Yes?
Is it possible to save the video clips for last and do all the questions first?
No, you have to, no, I think they're interspersed. There's questions.
So I know when I took it
You can do that, but you can mark a question and then go back to that question with the clip. I believe you can still do that because it's tied to the question. The thing is, you can't go back into the individual clip at the time. You got what I'm saying?
Once you play,
You're done. Then you have to go back through it and play it from the beginning again if you want to do that.
So a good strategy would be do all the questions and then come back and just do those videos.
Right. So yeah, mark them and then you could go back to those. So yes, that's one of the things with the. So remember, for those of you who have not taken a computerized test yet, you used to be able to just mark on your paper which ones you wanted to go back to. Of course, for those of us who are used to paper, which I'm guessing from people who really want the syllabus is quite a few of us. So, it's going to be a different experience for you. You're not going to be able to highlight and circle and anything else that you liked to do on the exam, right? You're just going to read the question. If you don't get it, if you want to go back to it, you click a thing that says go back to or whatever, and or review later or whatever. I don't remember what it says. And that's how you'll know how to go back to them.